NBC has exclusively obtained a critical part of the White House's plan to roll out vaccines for children ages 5 to 11 years old.
Yep, the federal government is partnering with the Children's Hospital Association to prepare at least 100 clinics with vaccines just days before the CDC authorizes the shots. The FDA is expected to meet on October 26th, that's next Tuesday, to vote on the COVID vaccine for kids 11 and under. The CDC will then discuss the final approval on November 2nd and 3rd. If approved by both agencies, the COVID vaccine will be available for kids ahead of the holidays. NBC News correspondent Heidi Presbella joins us now from outside Children's National Hospital in Washington, D.C. with more on this exclusive report. Heidi, good morning. Tell us about this partnership between the White House and the Children's National Hospital to get kids vaccinated and this head start.
Yeah, good morning, Vicki. This announcement coming within a few hours. NBC News has learned exclusively that a major portion of the White House's plan to get as many children vaccinated as possible before the holidays is to partner with children's hospitals like this one I'm outside here in Washington, D.C., but it won't be limited to this one. It will be at least 100 to 200 children's hospital associations. And doctors say that this is a critical difference with how we approach vaccinating children versus how we approach vaccinating adults. Take a listen to some of the doctors here who are on the front lines.
There's a group of people that want to have that one-on-one conversation with the trusted medical provider, their family members, to just hear more about the experience, see more people getting it, and feel more comfortable with time. And there's a lot of evidence that even just having that conversation, even if you have to do it over and over, can really help people make a decision that's safe for their family.
So the White House believing that it's going to be difficult to get children vaccinated unless it's done by doctors, nurses, and trusted healthcare providers, which is a very different look, guys, than when we had those mass vaccination clinics run by FEMA.
Well, the holidays, of course, just around the corner, Heidi. The looming question really remains whether or not the U.S. is going to see another surge in cases. I read an estimated 28 million kids are part of that 5 to 11 age group. So talk about the importance of vaccinating kids, not just to keep the spread of COVID down through the winter, but potentially for good and making it endemic.
Well, look, September, Vicki, really put a rest to the lie that COVID does not affect children. We saw surging cases. We saw surging hospitalizations across the country, particularly in the Deep South. And the White House knows by looking at the data that we cannot put an end to this pandemic unless we have many children vaccinated. But at the same time, they're concerned about parents who even themselves may be vaccinated, who have hesitation or just questions. Take a listen to some of the doctors here who I interviewed.
To get back to normal, a sustainable control of this disease is not possible without covering children. The math just doesn't add up. That's the secondary reason. But it has a benefit not just to adults if children get vaccinated, but for children themselves. So return to normal impacts children themselves, their own education, but also their entertainment and normal life. So they are part of the society and they have a stake in normalization.
So here's the concern. The latest polling shows us good news that 2/3 of parents do plan to get their kids vaccinated. However, when you break that down, only 1/3 say that they want to do it immediately. Another third say they'll wait and see, and 24% say no way. We need numbers higher than that, particularly going into the holiday season, guys.
Yeah, we showed that graphic a little earlier. I was going to bring that up, Heidi, because look at that. The wait and see, 32%. Who knows how long they want to wait and see. Parents are hesitant to vaccinate their children. How are doctors working on the messaging ahead of this upcoming vaccine rollout? What's the White House doing to help with those efforts?
Well, this is really a big part of this plan, is that the messaging will be coordinated between federal officials, HHS, as well as these children's hospitals. And the reason why the children's hospitals are important is because they're not just places where some of the sickest children who would be most at risk for severe case of COVID would come, and you can reach those kids with like immunocompromised systems or diabetes, asthma, but they are also entrees to some of the rural communities. communities that are going to be the ones that will be harder to reach. For instance, I spoke with some doctors in Arkansas about the messaging as well and why this is important. Take a listen to one doctor who herself is a mother and got a little emotional about this moment that we've all been waiting for.
I have to remind myself as a doctor and a mom that as much as I think about coronavirus every day, that's not necessarily the most important thing on everyone's mind. And so I see that day to day in clinic. People have other obligations. They've learned to live within this environment of coronavirus. And so they're making choices to decrease their risk and keep themselves safe. And if this one seems scarier to them, they might just need more time to adjust, to hear more.
So the timing is really important here. If we do see this authorization that comes out the first week of November, we are then running headlong into the holidays with just weeks before the Thanksgiving holiday travel rush. Ladies?
All right, Heidi Preswell, so much information about how this is all going down. Thanks so much this morning.